Hello everyone, this is James Braithwaite of Braithwaite Physiotherapy, the newly renamed physiotherapy practice with just me, so Braithwaite Physiotherapy works well. Today we're going to talk a little bit about how to manage disc injuries. Disc injuries are super common causes of shooting down the leg, nerve pain, as we call it in the biz, radiculopathies, but that's just a term for pain going down the leg. Sciatica is a common name for it, although sciatica, on a side note, is an umbrella term that can refer to nerve pain of a number of different causes. The one cause that we're talking about today is nerve pain that's caused by disc bulges or disc herniations, okay? So first of all, what's the difference? Well, a disc bulge is where you've compressed the spinal cord, or spinal column, I should say, in such a way that the disc between the vertebrae, the soft, squishy thing with some jelly in the middle, is bulged like a compressed water balloon into a nerve, right? That's a disc bulge. A disc herniation is where that water balloon ruptures a little bit in some of the water or jelly, or in this case nuclear material, that's what it's called in the disc, leaks into the nerves of the spinal cord or the peripheral nerve, and that jelly, that stuff in the middle of the disc can cause quite a heck of a lot of pain. People who have herniations, that ruptured disc, they're on the floor, they're not, they don't want to move at all, they're in really, really bad shape. For people who have just the disc bulge, it's typically more movement pattern related, right? So typically for people that have disc bulges, those are the people whose down the leg pain is worse when they're sitting, say driving their cars, or they're at their desk, typing on their computer, bending over to tie your shoelaces, anything that involves spinal flexion like that, right? Requiring you to sort of bend over, as you might do when you're driving, or typing, or bending over to tie your shoelaces, as I just suggested. So, for those herniations, different beast. I mean, that's a really difficult one to manage. For disc bulges, there's a few common things that you might want to try at home to help to manage this. Let's talk about them right now. One is keeping good spine neutral posture, or even spine extended posture. What I mean by that is you're literally avoiding those aggravating positions. You're staying away from this, right? And you're moving into neutral positions. So the chin is tucked, the chest is high, the shoulder blades are tucked, right? And that way, when we sort of move around, or when we're at our desk typing, if you're in a sitting position, you can hold the same types of postures. You're at least not going into that flexed position that can bulge the disc out even more into the nerve and cause continued aggravation. So maintaining spine neutral posture, that was number one. Number two is even moving into extended postures. So for a lot of people, doing simple positional exercises such as the sloppy push-up, which you might have heard of if you've had this problem before. That's where you're down on the ground and you're sort of getting your spine into a curved up position, ever so gently like that. You're not going to the ends of the earth and back. If you really want to impress everyone and take it a little bit further, you can do a little bit of a sloppy push-up like this. That often can help. That type of movement can help with repositioning the disc and getting that bulge away from the nerve. So you can try that. It should always feel better. If it feels worse, don't do it. You never do this type of stuff into pain. But if you've got a simple disc bulge, that exercise can be helpful. So you might want to try that. Extending that into daily life type activities. The last client I had in the office was doing this to manage their disc issue. They were swimming a lot. So you can imagine, we just talked about that sort of push-up into extension posture. If you're doing swimming in a pool, you're doing lap swim, and you're doing your front crawl, you're going to be in those sort of extended back positions. So lap swimming with a front crawl, a stroke can actually be a great exercise as well for a disc bulge. Having said that, again, never do it through pain. If it hurts when you do the activity, definitely don't do that activity. This is not a no pain, no gain type scenario. So try those things. Try the neutral posturing, right, with the chin tucked, chest high, shoulder blade tucked type postures to avoid flexion. Try even going into extension with, say, your sloppy push-up exercise that we just did. And if you want to do like just a regular fitness type activity that can help with this type of problem, try lap swim. It's a great activity. It can work. and you can see if it works for you. As always, you can send me questions by email. You can leave a comment in the comment sections below. I will answer them. Until next time, James Braithwaite.